The latest research on aging. What's new? This is the question we ask every month in our Aging Edge seminar series. And today, I'm very happy to share with you what we learned in November. So let's dive into 5 interesting studies that were published recently and will help you live longer and healthier lives. The first study was about vitamins, and specifically about vitamin B3. That's niacin. In this study, they looked at a group of people over 60 years old. They were taking B3 for about 2 months, and they wanted to see how that would affect their immune system. And what they found was that this group of older people had better immune function after just 2 months of taking this supplement. They also found other benefits. For example, there was a reduction in inflammation and an increase in the number of telomeres. So what does it mean? It means that these people now have shorter, less long telomeres. Telomeres are these protective DNA sections at the end of your chromosomes that protect them from being damaged. Think about them like these little plastic tips at the end of a shoelace. Now, the shorter they become, the faster you age and the more diseases you develop. So this is very exciting. Just taking something as simple as vitamin B3 can improve your immune system and slow down aging. But here's the problem. This study did not tell us how much to take, how often to take it, or which formulation to take. If you want to learn more about the best formulation and dosage, watch my interview with Dr. Bredesen on this channel. There is a link below. Next, we have a study on fasting. We know from previous research that fasting has incredible benefits for slowing down aging and for extending lifespan. However, this study dug a little deeper and tried to figure out the optimal duration of fasting. How long should you fast to get those amazing benefits? In this study, they looked at mice, but the results can be applied to humans as well. They found that the sweet spot is between 24 and 72 hours. You don't want to go beyond that, because after about 72 hours, you start getting some negative effects. So if you're going too fast for more than 3 days, you need to make sure that you do it correctly. You need to plan it, prepare for it, and make sure that you have proper medical supervision. But for most people, fasting for 1 or 2 days a week is more than enough to produce all of those amazing epigenetic changes. And by the way, it's not just about food. Fasting also includes the time when you sleep. So if you sleep for 6 hours a night, you're not really fasting. Next, let's talk about another nutrient that's becoming more and more popular. That's spermidine. Spermidine is a polyamine. That's a natural substance found in cheese, mushrooms, and peas. And it's been shown to extend lifespan in yeast, flies, and even mice. And this study looked at whether spermidine could reduce the risk of cardiovascular disease and cognitive decline in humans. And the answer is yes. If you look at your gut microbiome, you can find bacteria that produce spermidine. So if you eat foods that support a healthy gut, such as fiber, prebiotics, and probiotics, you can boost spermidine levels in your body naturally. However, there is a big problem. The bioavailability of dietary spermidine is extremely low. In other words, very little of it gets absorbed into your blood when you eat it. Only between 0.1 and 2% of it gets absorbed. That's why you're probably wondering, if you eat cheese and mushrooms, why doesn't spermidine have any effect on you? Well, that's the reason. Fortunately, there is a company that's working on a solution for that. They've created a formulation that increases absorption up to 17 times. And I'll put the link to that product below. Another interesting study was conducted by a company called Life Length. They're doing some amazing things related to telomeres and telomeres activity. And this study investigated whether a combination of 4 natural supplements could improve telomere length in adults. The results were positive. These 4 supplements were zinc, vitamin C, green tea extract, and pomegranate extract. Interestingly, they also found that the combination of these 4 supplements improved participants' health in general. They became less sick and missed fewer days of work. So this is a great reminder that you shouldn't focus just on one aspect of your health, such as weight loss or cognitive function. Instead, you should take a holistic approach and work on improving your overall health. The last study was on a popular nootropic called alpha-GPC. Nootropics are substances that can improve cognitive function. Alpha GPC is a synthetic version of a natural substance called choline. It's found in milk and soybeans. It's believed to enhance memory and cognition by increasing choline availability. Choline is a precursor to acetylcholine, which is a neurotransmitter involved in learning and memory. In this study, they found that alpha GPC improved verbal fluency, visual motor coordination, and selective attention. The only problem with this study is that it was done on a very small group of healthy young adults. So we still need more research to confirm these findings and to determine if it works on people who have cognitive impairments or memory loss. And now, let me share with you the bonus. I have a wonderful interview with Professor Brad Stanfield. He's a world-leading expert in longevity and aging. He's a professor at the University of Washington School of Medicine. In this interview, we discuss the latest research on aging. We talk about calorie restriction, fasting, ketogenic diet, intermittent fasting, the role of exercise, and much more. You will be amazed at what we discover. So if you want to learn more about aging, watch this interview. The link is provided below. Now, if you enjoyed this video, you must watch the next one, where I discuss how to live to be 100 and beyond. I will list the videos here and below. And please subscribe to my channels. I have new videos almost every week. You can also follow me on social media. Have a wonderful day. Bye-bye. Hey guys, I hope you are enjoying this channel so far, and I hope you subscribed already. If you did, do it. And if you did, watch this video right there. I think that will help you too.